Now, health and medicine. Cholera first appeared in Britain in 1831. There were two further major outbreaks in 1848 and 1854, by which time it killed around 140,000 people. The disease struck suddenly, causing retching, extreme thirst, and pain in the limbs and stomach. If a patient's skin turned blue, it was usually fatal. Health and medicine. Public health improved enormously in the second half of the 19th century. This was mostly due to the pioneering work of Florence Nightingale and others who made new medicine discoveries and convinced the government to take responsibility for the nation's health. Something in the water. During the 1830s and 40s, a number of deadly diseases, including influenza, smallpox, and cholera, swept through Britain, killing hundreds of thousands of people. The worst hit were the poor in towns and cities. A civil servant named Edwin Chadwick carried out a study for the government to find out why. He argued that the spread of diseases could be prevented by cleaning up the slums. Most Victorians believed that diseases were caused by foul-smelling air, known as miasma, but a doctor named John Snow disagreed. He proved that cholera was carried in water polluted with sewage. In August 1854, an epidemic broke out in central London. By marking all the cases of cholera onto a map, Snow traced the source of the outbreak to a public water pump. When he disabled the pump, the number of new cases of cholera fell instantly. Waterworks. Gradually, the government took note of the work of men like Chadwick and Snow. It began to build new sewage systems, improved water supplies, and ensured that local councils collected household waste regularly. Under the knife. Going to a hospital in Victorian times could be a frightening ordeal. Until the 1840s, there were no efficient painkillers, and surgeons didn't use anesthetics to put people to sleep during operations. Wow. Some patients were so traumatized by the pain of surgery that they died of shock. Things improved radically in 1847 when chloroform gas was first introduced as a safe anesthetic. Queen Victoria herself used it during the birth of her 3 youngest children. On the wards. When Florence Nightingale came back from the Crimean War, she was determined to raise the standards in British hospitals. She set up a nursing college in London and carried out an inspection of British hospitals. She found them so filthy that some patients were catching diseases on the wards, and others were dying from infections spread by doctors who didn't wash their hands or sterilise their instruments. Florence Nightingale campaigned with the government to improve hospital hygiene. Hospitals became even cleaner after 1869, when a doctor named Joseph Lister invented an anaesthetic spray to kill the bacteria that spread infections.